Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Here we want to present our biochemistry assignment to raise a case about Niemann-Pick disease type C or NPC. So this is our member of the group. First myself Aswin Mada Adyatma, and then Abigail Paramuthia Permadi, Sabrina Ayu, Atsir Farhan, and Marchya, Jasmine, Aqila, Gustina.
What is Niemann-Pick disease? So basically, Niemann-Pick disease type C or NPC is a rare progressive genetic disorder characterized by an inability of the body to transport cholesterol and other fatty substances or lipids inside of cells. This leads to the abnormal accumulation of this substance within various tissues of the body, including brain tissue.
The cause of Niemann-Pick type C has more to do with the body's inability to efficiently remove excess cholesterol and other lipids. Without proper breakdown process, cholesterol will accumulate in the spleen and liver, and other excess fats will accumulate in the brain.
Next, these are symptoms caused by Niemann-Pick disease. The first is enlarged liver and spleen or hepatosplenomegaly. Second, difficulty coordinating movement or ataxia. And then abnormal eye movements or vertical supranuclear gaze palsy. And the fourth, poor muscle tone or hypotonia. And then severe liver disease. Next, diagnosis of Niemann-Pick type C. The diagnosis of Niemann-Pick type C is usually made by means of skin biopsy, which is marked with a special color. Once the sample is taken, an analysis of how the skin cells grow and how they move and store cholesterol will also help determine the diagnosis. A DNA test may also be done to look for genes that might cause type C Niemann-Pick disease.
Next, this is the process. First, cholesterol reaches the cell packed in lipoprotein, which bind to low-density lipoprotein or LDL receptor on the cell membrane to get inside the cell. Then, cholesterol reaches the early endosome, which is an intracellular organelle that eventually matures into late endosome and finally into a lysosome. Inside the lysosome, cholesterol is processed and recycled. It can be incorporated into the cell membrane. To get off the lysosome, cholesterol gets a little help from the NPC2 gene product, a protein that carries cholesterol up to the lysosome membrane. And on this membrane, cholesterol is greeted by the NPC1 gene product, which is a glycoprotein that moves cholesterol out of the lysosome and into the cell. So, with NPC1 or NPC2 mutation, intracellular cholesterol transport is impaired. So, cholesterol accumulates inside lysosome instead.
Next, treatment. The treatment involves supportive therapy using miglustat to slow neurological decline. Even though there is no cure for NPC yet, but research is going strong and several medications that target different steps in the pathology of NPC have shown promise in animal models of the disease and have progressed to clinical trials in humans. Alright, as a quick recap, Niemann-Pick disease type C is a rare genetically inherited condition caused by mutations in the NPC1 or NPC2 genes, which impair intracellular cholesterol transport. This causes cholesterol to accumulate in lysosome, resulting in brain, bone marrow, liver, spleen, and lung damage. Diagnosis includes blood tests and genetic sequencing, and treatment is mostly supportive.
Maybe that's all an explanation from us, and maybe I can see more complete explanation in this following video.
Niemann-Pick disease type C, or NPC, is a rare, genetically inherited condition caused by mutations in either the NPC1 or NPC2 genes. These mutations impair intracellular transport of cholesterol and other molecules, which causes progressive neurologic and developmental problems. Now, cholesterol reaches the cells packed in lipoproteins, which bind to low-density lipoprotein, or LDL receptors, on the cell membrane to get inside the cell. Then, cholesterol reaches the early endosome, which is an intracellular organelle, that eventually matures into a late endosome, and finally into a lysosome. Inside the lysosome, cholesterol is processed and recycled, so that it can be incorporated into the cell membrane. To get out of the lysosome, first, cholesterol gets a little help from the NPC2 gene product, a protein that carries cholesterol up to the lysosomal membrane. And on this membrane, cholesterol is greeted by the NPC1 gene product, which is a glycoprotein that moves cholesterol out of the lysosome and into the cell. So with NPC1 or NPC2 mutations, intracellular cholesterol transport is impaired, so cholesterol accumulates inside lysosomes instead. Mutations can affect people of all ethnic backgrounds, and they're inherited in an autosomal recessive pattern, which means that an affected individual must have 2 copies of the mutated gene, one from each parent. Cholesterol buildup affects almost all cells, so it causes a variety of symptoms. The brain and bone marrow are often affected. The liver and spleen can be affected too, in which case they enlarge. Liver enlargement disrupts bile flow, causing bilirubin to accumulate in the blood. This leads to jaundice, or yellow pigmentation of the skin and whites of the eye. An enlarged spleen, on the other hand, may trap platelets, which causes easy bruising and bleeding issues. Finally, when this buildup occurs in macrophages, they develop a characteristic lipid-laden appearance under microscopy and are called foam cells. The most common symptoms are progressive neurologic symptoms, which occur in almost all affected individuals. With early infantile onset, there is usually low muscle tone and delay in developmental motor milestones, like lifting the head or crawling. Later, these children experience developmental regression. Infantile and childhood onset often begins with clumsiness and learning difficulties, and progresses to unsteady gait, difficulty swallowing, and slurred speech. Some children experience seizures or cataplexy, which is a sudden loss of muscle tone provoked by something perceived as amusing. With teenage or adult onset, there can be psychiatric symptoms and progressive cognitive impairment. Jaundice is more common in newborns, but rare in older children or adults. Late in the illness, patients lose the ability to walk, talk, and swallow, and respiratory failure is a frequent cause of death. Diagnosis of NPC is based on the clinical examination and history, and blood tests
to detect biomarkers like bile acid metabolites and oxysterols. Finally, genetic analysis of the NPC1 and NPC2 genes confirms the diagnosis. Treatment involves supportive therapy, and in many countries, miglustat is used to slow neurological decline. Even though there is no cure for NPC yet, research is going strong, and several medications that target different steps in the pathology of NPC have shown promise in animal models of the disease and have progressed to clinical trials in humans. Alright, as a quick recap, Niemann-Pick disease type C is a rare, genetically inherited condition caused by mutations in the NPC1 or NPC2 genes which impair intracellular cholesterol transport. This causes cholesterol to accumulate in lysosomes, resulting in brain, bone marrow, liver, spleen, and lung damage. Diagnosis includes blood tests and genetic sequencing, and treatment is mostly supportive.
There are a few different types of Niemann-Pick disease. Niemann-Pick A and B are caused by a single gene and a single enzyme defect. And Niemann-Pick C sounds similar, it has the same name, but it's a completely different disease. They were originally thought to be the same, so that's why they have the same name. But I focus on taking care of patients with type A and B Niemann-Pick. These are very, very rare diseases. In fact, Niemann-Pick A and Niemann-Pick B are so rare that we don't even have a good estimate for how many people might have them. Type A Niemann-Pick is a disease that affects infants. Typically, babies who have type A disease develop symptoms when they're between 4 and 6 months old. They'll have big livers, big spleens, so their bellies might look big. They might have challenges eating. The parents might notice that they're a little bit weak. Usually by the time they're about a year, they finally get a diagnosis. Unfortunately, there's no specific treatment for Niemann-Pick A right now. So over time, the babies will develop worse and worse neurologic disease where they lose the ability to interact with their parents. They might not hear too well. They will become progressively weaker. And most babies with type A Niemann-Pick unfortunately die by the time they're between 2 and 3. Type B Niemann-Pick, on the other hand, again, it's the same gene, it's the same enzyme, it's just a milder form of the disease, doesn't cause brain involvement. People who have Niemann-Pick B typically develop symptoms often during childhood. Some people develop symptoms when they're adults if they're on the milder side. They usually have involvement of the liver and spleen, and those organs become enlarged. They usually have involvement of the lungs, where the lungs get progressively filled with substance, and they might have trouble breathing and oxygenating well. There is a clinical trial ongoing right now for Niemann-Pick B.
Okay, once again, let me read the conclusion again. Niemann-Pick disease type C is a rare genetically inherited condition caused by mutation in the NPC1 or NPC2 genes, which impair intracellular cholesterol transport. This causes cholesterol to accumulate in lysosome, resulting in brain, bone marrow, liver, spleen, and lung damage. Diagnosis includes blood tests and genetic sequencing, and treatment is mostly supportive. Okay, this is the reference we use in preparing our presentation. Maybe that is all from us. Thank you so much for your time and attention. Thank you so much, and wassalamualaikum warahmatullahi wabarakatuh.